mums, Claire from Mama to Yoga. Joining me, of course, is my beautiful muse again and new mom to be almost in 1 week, Monica, who's 39 weeks pregnant. So in a previous video, I talked about how to come in and out of poses safely with mums and postpartum. And of course, Monica had the same question. How do I move in and out of poses where I'm not exacerbating the diastasis recti? So if you haven't already seen the video on what diastasis is, please go ahead and view it. This is the abdominal separation that naturally occurs in pregnancy. So what I'm going to get first Monica to do is just roll over to her left side. Perfect. And then she can gently roll onto her back if she's comfortable to do so. We won't be here too long. So sometimes, of course, the concern of laying on your back in pregnancy is something called your vena cava. So this is the blood supply. It's sort of an artery that supplies blood to mums. And it can be, of course, detrimental in the third trimester just with weight gain. But we're only here for a few more moments. So if you feel okay. Awesome. So the problem, of course, if you just see if Monica was to lift her head and shoulders off, hey, you have pretty good. There's not a ton of separation there. Wow, that's impressive. So generally what happens, nice strong mom, is when they do this, you can see just a little bit of peeking here. So that's the left and the right side of the rectus, and then the connective tissue that's stretching in between. So she's actually done really well. You have a little bit of separation happening up at the top, but that's normal. And even though you carry quite low, your abdominal separation seems to be here. But of course, how do we not, we can't allow mums, like if Monica tried to lift up all the way, then you can see the peak. That just also pulls that xiphoid process down on the top of the uterus. It's not comfortable. Not only that, it puts all this pressure down towards the pelvic floor. So the appropriate way to come in and out of poses, even if you're in your bed, please don't fling yourself out of your bed, which we sometimes do as moms, especially when we have other children. So what we always want to do is if she just pushes down really strongly through her feet and kind of lifts her pelvis up and rolls onto the left side of the hip, good. Pausing here, and then she can press into the palm of the right hand and lift herself to a seated position. So that's how we appropriately come in and out. Of course, going down is the same way. You'll slowly begin to lower. You can hold on or hug on to baby using that cue to give a little bit of abdominal support. Lift the pelvis up, and then we kind of settle the back of the sacrum on the floor. So that's the appropriate way, especially if you're moving into yoga practices. We never lay on our back too long, especially with a mom in her third trimester, maybe 1 to 2 minutes. If she doesn't feel nauseous. If I use supine positions in class, I usually have my moms roll over for a few moments to rest and then back on the back to do the other side. So if we're just doing the left side, then roll them over, come back, and then do the right side. So please do not lift up. Don't hike yourself up. Don't push yourself up. Make sure that you're lifting the pelvis, rolling over. So one more time, grounding through the feet, pelvis lifts up. So she rolls onto the side of the hip, pausing here for a moment, and then gently comes back to center. Great. So please go with much more cautious and awareness onto these transitions of how you come in and out safely, because again, maybe not the concern is too much in pregnancy, but it's the postpartum. As a postpartum corrective specialist, it's always what we're looking at is how we can then gain moms more mobility and strength after pregnancy and some of these things that we did. So hope you enjoyed the video. We will see you again soon.